A small gap between the front teeth can sometimes be improved with cosmetic bonding after a professional evaluation. The dentist first confirms that composite bonding is appropriate for this particular gap. In this example, the teeth are healthy and the space can be closed by carefully reshaping their outer surfaces. The tooth surfaces are gently cleaned and prepared to help the bonding material attach securely. A bonding agent helps the composite securely attach to the natural enamel. Tooth-calivered composite is carefully added in small amounts for precise control. The dentist carefully sculpts both teeth to create a balanced and natural-looking smile. A curing light hardens the composite to create a durable restoration. The new tooth contours are refined to match the natural smile. Polishing creates a smooth surface that blends beautifully with the natural enamel. The final result is checked for symmetry, function, and a natural appearance. Good daily oral hygiene and regular dental visits help keep bonded teeth looking their best. This video is educational and not personal medical advice.